Have you heard about the emerging role in the healthcare sector called decision support? In this short video, you will learn more. Perhaps you have the following questions. What is decision support? What is there for me if I want to start a job or transition into a decision support role? What skills do I need to start my career in healthcare as a decision support specialist? What skills employers and workplaces are looking for? A little bit of an overview of what is decision support and what employers are asking from anyone applying for this role.
Perfect. Thank you. And I think maybe I'll actually jump off where Reza kind of said is really kind of leveraging data and evidence to help make decisions in an organization, right? And this is actually, if you look at it from, there's the provincial kind of agency level, like Ontario MD, like Ontario Health, where they're looking at data sets all across the province, like your OHIP billings, to really understand what's happening, where they should be investing money, where are issues, down to more maybe regional programs, like at the home care, different home care agencies across the province, to again at that level, like as we go down further from provincial to regional, there may be other problems or other issues to look at, and then all the way down at the service provider level. And when I say service provider, I'm talking about hospitals or primary care clinics, or home care kind of service providers. And at that level, really kind of understanding at a much more detailed level of what's happening at the hospital, what are how many beds are being occupied. And during COVID was a good example, really understanding how many people have COVID. Should we be cohorting patients? Are we going to run out of ICU beds? So really decision support plays a key role in that, and really kind of translating all the data that's out there to understanding that to be information, and then how do you act upon it? And that could span, again, all these different levels. In terms of kind of terms used by the industry, we have a couple listed here. On top of that, you typically, you can see also kind of business partners. I have seen, or analytics consultants is another kind of a word for it, and some other areas I've also seen a little bit more generic, senior analysts or a data analyst. So those are some terms that's used by the different industries. In terms of employment level, like myself, I'm a manager that I kind of work through the decision support or analytics route. Obviously, this it has both an entry level all the way up to manager and above in terms of what it can be. In terms of, I think, opportunities for the healthcare sector, I think this will be more and more important as we kind of move along the maturity of analytics in the healthcare sector. In some ways, healthcare is a little bit behind in terms of what we do with data, right? A lot of our data now are looking at descriptive information and maybe trending information as we move into more, I guess what we would call predictive modeling or prescriptive modeling, to understand, well, not what happened, but building a model to understand what may happen a year from now, or what would happen if we open new beds, what would happen to our length of stay of people staying. So I think it's a high demand role, like we're seeing it across, again, all spectrums of different healthcare organizations. And finally, in terms of kind of last bullet there, skills that employers or workplaces are looking for. Obviously, I've kind of touched on analytics, data, but I think key to this role is also there's a lot of interaction with stakeholders. Our job is to understand what their problems are and how we can inform them by, again, kind of translating the data into information. So a lot of stakeholder information, really understand, I think, the context of where the data is coming from and where it's going, right? So understanding the priorities of the province will give insight into, oh, these are areas that I might want to investigate for my hospital or for my family health team. Again, so these are all like critical functions in a hospital and other organizations too. Maybe I'll pause here, Reza. You'll probably have kind of a more to add here, so I'll pass it to you.
Oh, thank you. No, you covered it really well. Thank you for that. So the only thing I would like to add is this is a very kind of unique and niche opportunity and work opportunity, basically. That's why you see so many different terms are being used, even, quality improvement specialists, things like that. The reality is, as Jonathan mentioned, part of it is because of we are lucky enough that we are in the time of information explosion, I would say. So we have access to too many, different data and information sources, and as, as it is a great, a fantastic opportunity to have this wealth of knowledge. At the same time, it brings a lot of challenges to the organization, and specifically healthcare. Healthcare is a very data and information intensive domain. And now that you have more data available to you, it may create more confusion. You don't know which one to pick, how to use it, and where to basically start your intervention. So that's where this course is coming from. And that's why, everybody's using different terms, because this is a kind of an interdisciplinary, multidisciplinary kind of a role that is basically emerging and becoming more and more in demand in the domain.